Dr. Thornley, and I'm a neurologist subspecializing in epilepsy, and this is part 4 of my medical marijuana series. Part 1 went over an introduction of the mechanisms, the indications. Part 2 went over the legalities. Part 3 went over the application process. Because there's so much confusion and complexity, I'm going to go over a little bit more in detail about the application process. So when I see a patient, basically you have to be first a qualified physician. There's only 1,200 in the state. They evaluate and diagnose you and see whether you meet the criteria. After that, then you go through the application process, and you could do it online with this address here. And if it's done online, it's supposedly faster. It takes about 2 months, and then it's connected to DMV, so you get your ID connected to it, so that you have a picture ID through DMV. If you do the paper application, then your physician will give you your registry number, and then you send it to this here with a $75 fee, money order or check, and then you get a passport size picture at any pharmacy. And then in addition, you have to fill out the risks and benefits, you need to understand the risks and benefits and also sign a consent form. So this process takes about 2 months. There's about 90,000 registrants. Only 1,200 physicians are qualified to see and evaluate these patients. And there's about 2,000 every month who are being registered every month for to this registry. So after that, when you get your ID card, you call the dispensary of your choice. There's about 21 dispensaries now, no longer 7. There's now 21 licensed dispensaries. You call the dispensary, they call your doctor's office. Your doctor's office will call the dispensary about the orders, and then it's advisable to visit a pharmacy dispensary at least once, so that they could give you all the information about the different products involved. When I see a patient who comes in, I usually go over this, give them a background. So all my video series will be overlapping. So there's an endocannabinoid pathway naturally found in your system. You have a sense of well-being, and it's responsible for the runner's high that people get. And within this pathway, there are 2 phytocannabinoid products within the marijuana plant that works in this pathway. The CB1 receptor is found abundantly in your nervous system. So cannabidiol, which is non-psychoactive, works on this. And then you have Thc Tetrahydrocannabinol. You need 100 times of CBD to get the euphoria as THC. So CBD is non-euphoric. Low-dose THC is non-euphoric. That's what you get into the higher dosages that you can get side effects. I normally start patients on cannabidiol because you have to wait 2 months anyway. Cannabidiol is non-euphoric, and it helps with anxiety, pain, seizures in animal models with anti-tumor effects. It helps with anxiety, PTSD-like symptoms. It works through the serotonin 5-HT1 receptor, so it helps with depression. So with cannabidiol, you can use it by oil or by cream. Cream is 12 hours, and the oil is about 7 hours. Now for the THC, tetrahydrocannabinol, it's usually used 1:1 ratio, and then the ratio increases. The CBD offsets the side effects of the THC. So the THC has also medical value, and you start at a low dose, 1 part CBD, 1 part THC. I usually start 50 milligrams twice a day, and then I go up incrementally by the week. Don't do it every day. It has to get steady state within your system. A disclaimer, this is only medical information and not medical advice. So you go up incrementally by the week. When you're maxed out on the product, you go to the next ratio, 1:2. Start at 50 milligrams twice a day for a week. 3 times a day for a week. Go to the next chunk of milligrams. You can do 75 milligrams twice a day for a week, and then so on and so forth. And then you could, if that doesn't work, you can do 1:4. Now at higher doses of THC, you can get side effects of hyperactivity, agitation, sedation, meaning you can get sleepy, dizziness, and there's also, and then there are different brands or names. So if you hear the name indica, It's usually more sedating. It helps with anxiety and insomnia. So the indica is very sedating. It's only recommended at night. And then there's hybrid and sativa. Hybrid is amounts of CBD and THC, so there's a proportion of that. And that's used for a wide variety of conditions. When you get into the sativa, there's a little bit more THC. So you have pure CBD, which is non-psychoactive. You have equal amounts of CBD THC, which covers all ranges of medical problems. And as you get into the higher ratios of THC, then it becomes more potent to use for epilepsy, chronic pain, spasms. So you have to be aware of the side effects. Your body will tell you how much you need. If you have symptoms, then you go back down. If you feel side effects, you go back down. If you have symptoms, then you go up incrementally, so by the week. If you're having side effects, then you go down, you stop at that dose or you go down. So your body will tell you how much you need. And then, yeah, so there are different ways of taking it. There's oral, which is 6 to 7 hours. Cream, 12 hours. A patch is 8 to 12 hours. That's how long it lasts. And then a pump or a vaporizer cartridge will last about 1 to 2 hours. When you take the cartridge, it goes into your lungs and can give you effects very quickly. So I always tell patients, whenever you use a new product or a new way of taking it, use it at home to see how you feel first. That way you know the effect on you. If you've taken it before, then you might need a higher dosage compared to someone who is naive. And you always reserve the highest dose of THC for anyone with end-stage symptoms, such as, and again, not to disturb you, someone with end-stage disease, like someone who's terminally ill. So this is just a video to try to help patients try to get through the chaos and the complicated way of trying to get to their product in order to help alleviate their symptoms. Because I often get comments like, do you have a website or is there a handout? So I'm trying to facilitate my patients because it can be very complicated and complex. Okay, so this is part 4 of my medical marijuana series, and in my next series I'd like to talk more about the diseases, animal models. I might go a little bit more on how the products are taken, and then go through other ways of taking it and demonstrations. Okay, this is Dr. Thornley signing off.